Welcome back. Today we are diving into healthy aging, specifically how to support your joints and ensure long-term wellness.
If you live with arthritis pain, you already know what the worst moments feel like. The stiffness when you wake up and your hands refuse to open properly. The sharp protest from your knees when you try to stand from a chair. The ache in your hips that keeps you awake at 3 in the morning, shifting positions and finding no relief. You have tried things. You have taken medications. You have followed advice. And yet the pain keeps showing up every single day like an uninvited guest who has decided to move in permanently. What if I told you that there are specific compounds found in foods you could be eating tonight, before you go to bed, that work while you sleep to interrupt the inflammatory cascade that produces arthritis pain? Not as a replacement for the medical treatment your doctor has prescribed, but as a real, research-supported addition to everything else you are doing, one that could make a measurable difference in how you feel when you wake up tomorrow morning. I am going to share with you 7 specific things you can eat or drink in the evening, before bed, that the research on inflammation, cartilage biology, and joint pain has consistently identified as the most effective natural anti-inflammatory interventions available. I am going to tell you exactly what they are, exactly why they work, and exactly how to use them. And I am going to give you a 10-day protocol that, if you follow it consistently, gives the science the time it needs to produce results you will actually notice. Before we go any further, if you find this kind of information valuable, please subscribe to this channel right now. We publish evidence-based health content every week specifically for people who want real answers about their bodies, not general advice, not marketing, but the actual science explained clearly. Hit that subscribe button so you never miss a video. Now let us talk about what arthritis pain actually is at the biological level, because understanding the mechanism is what makes the interventions make sense, and what will help you choose the right ones for your specific situation. Arthritis is an umbrella term that covers more than 100 different conditions affecting the joints. The 2 most common forms in adults over 50 are osteoarthritis, the mechanical degeneration of joint cartilage and the bone changes that accompany it, and rheumatoid arthritis, the autoimmune condition in which the immune system attacks the synovial membrane lining the joints. Although the root causes of these 2 conditions are different, they share a critical common pathway that is responsible for the pain both produce: inflammation. Inflammation in the joint involves the same biochemical cascade regardless of whether the trigger is mechanical or autoimmune. Inflammatory cytokines, molecular signals including interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha are produced by immune cells in the synovial membrane and in the cartilage itself. These cytokines activate the enzyme cyclooxygenase 2, which produces prostaglandins, the local inflammatory mediators that sensitize pain receptors, produce the warmth and swelling of an inflamed joint, and, in sustained inflammation, promote the progressive destruction of cartilage and bone. This is the same pathway that the most commonly used arthritis medications target. Non-steroidal anti-inflammatory drugs work by inhibiting cyclooxygenase enzymes. The natural compounds we are about to discuss work through this same inflammatory pathway, but through different molecular entry points, often acting on multiple steps simultaneously, and with safety profiles that make sustained daily use appropriate in most people. Several of them have been directly compared to pharmaceutical anti-inflammatory agents in head-to-head clinical trials. The first compound is curcumin, the primary bioactive component of turmeric, the golden spice that has accumulated an impressive clinical evidence base for joint pain management in the past 2 decades. Curcumin works through multiple anti-inflammatory mechanisms simultaneously. It inhibits nuclear factor kappa B, the master transcription factor that activates the production of the inflammatory cytokines interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha. It inhibits cyclooxygenase 2, the enzyme that produces prostaglandins. It activates NRF, to the master antioxidant regulator that reduces oxidative stress in the joint tissue. And it inhibits the matrix metalloproteinases, the enzymes that destroy cartilage that are upregulated by sustained joint inflammation. A randomized controlled trial published in the Journal of Medicinal Food compared curcumin directly to ibuprofen in patients with knee osteoarthritis and found that curcumin produced equivalent reductions in pain and functional improvement with significantly fewer gastrointestinal side effects. For daily, sustained anti-inflammatory use, curcumin produces clinically meaningful effects with a safety profile that makes it more suitable for long-term use than daily NSAID therapy. The practical challenge with curcumin is its poor bioavailability when consumed alone. The solution is consuming curcumin alongside piperine, the compound in black pepper, which increases curcumin bioavailability by approximately 2000% by inhibiting the intestinal enzymes that would otherwise break it down before absorption. The before bed preparation. 1 teaspoon of turmeric powder, a pinch of freshly ground black pepper, a small amount of coconut oil or full-fat milk because curcumin is fat-soluble, and its absorption is enhanced by dietary fat dissolved in warm milk or a non-caffeinated warm drink. This is golden milk, and it is consumed 30 to 60 minutes before bed, when the anti-inflammatory effects can work through the night during the hours when inflammatory signaling in arthritis-affected joints is often most active. The second compound is omega-3 fatty acids, specifically EPA and DHA, from marine sources, which produce their anti-inflammatory effects through a mechanism distinct from curcumin that specifically targets the prostaglandin balance in the joint. EPA and DHA compete with arachidonic acid, the omega-6 fatty acid that is the direct precursor to the most pro-inflammatory prostaglandins, for incorporation into cell membrane phospholipids. When present in adequate concentrations, they replace arachidonic acid in the membrane, reducing the substrate available for inflammatory prostaglandin production. Simultaneously, EPA and DHA are metabolized into a class of anti-inflammatory compounds called resolvins and protectins, molecules that actively signal the resolution of inflammation rather than simply reducing its production. A meta-analysis published in the journal Pain, analyzing data from 17 randomized controlled trials, found that omega-3 supplementation produced significant reductions in joint pain intensity, morning stiffness, number of painful joints, and the need for NSAID pain medication in patients with inflammatory joint disease. The effective dose in most of these trials was approximately 2 grams of combined EPA and DHA per day. The before-bed approach, 2 grams of a high-quality fish oil supplement specifically standardized for EPA and DHA content, taken with dinner or before bed alongside a small amount of food. Alternatively, consuming a small portion of fatty fish, salmon, sardines, mackerel, herring at dinner provides meaningful EPA and DHA alongside other nutrients that support joint health. The third compound is tart cherry, and its specific evidence base for arthritis pain and morning joint stiffness is among the most directly relevant of any natural compound to the specific experience of waking with arthritis. Tart cherries contain extraordinarily high concentrations of anthocyanins, the polyphenols that give them their deep red color, as well as flavonoids and melatonin. The anthocyanins inhibit both cyclooxygenase 1 and cyclooxygenase 2 through a direct molecular interaction characterized in laboratory studies. A study published in the Journal of Functional Foods found that 2 servings of tart cherry juice daily in patients with inflammatory arthritis produced significant reductions in inflammatory biomarkers, including C-reactive protein and interleukin-6, over a 2-week period. A separate study published in the journal Osteoarthritis and Cartilage found that tart cherry concentrate reduced pain scores and markers of oxidative stress in patients with knee osteoarthritis. The melatonin content of tart cherries adds a dimension to their before-bed utility that goes beyond anti-inflammation. Melatonin itself has documented anti-inflammatory effects and has been shown to reduce inflammatory cytokine production in joint tissue. The before-bed preparation: approximately 240 milliliters, 8 ounces of unsweetened tart cherry juice or a standardized tart cherry concentrate providing an equivalent anthocyanin dose. Consume 30 to 60 minutes before bed. Unsweetened is critical. Sweetened cherry juice products contain added sugar that promotes the inflammatory state the anthocyanins are intended to reduce. Before we continue with the remaining compounds, here is a pause for you. Have you tried any of these 3 approaches: golden milk with turmeric and pepper, fish oil, or tart cherry for your arthritis pain? Drop a comment below right now and tell us. Your experience is valuable to every person watching this video who is trying to decide whether these approaches are worth trying. We read every comment. The fourth compound is ginger fresh, or as a supplement whose gingerol and shogal content produces anti-inflammatory effects that complement those of curcumin and omega-3 fatty acids. Ginger's primary anti-inflammatory action in the joint context involves its inhibition of both cyclooxygenase and lipoxygenase enzymes, the lipoxygenase pathway being one that NSAIDs do not typically address, making ginger's dual enzyme inhibition a broader anti-inflammatory action than standard NSAID therapy. A randomized controlled trial published in the journal Arthritis and Rheumatism compared ginger extract directly to ibuprofen and to placebo in patients with knee osteoarthritis and found that ginger extract produced significantly greater pain reduction than placebo and comparable reduction to ibuprofen, with better gastrointestinal tolerability. The before-bed preparation: a strong ginger tea prepared by simmering 1 to 2 centimeters of fresh ginger root, peeled and sliced, into cups of water for 10 minutes, then strained and consumed warm. Ginger tea can be combined with the turmeric golden milk preparation, fresh ginger, turmeric, black pepper, warm milk for a synergistic anti-inflammatory before-bed drink that addresses multiple inflammatory pathways simultaneously. The fifth compound is magnesium, and its role in arthritis pain management operates through the modulation of NMDA receptors in the spinal cord that govern the amplification of pain signals. Magnesium deficiency is estimated to affect 50 to 60% of American adults, and it is particularly prevalent in older adults. In the arthritis context, magnesium's role as an NMDA receptor antagonist is particularly relevant. The NMDA receptors in the spinal cord dorsal horn are the molecular machinery through which chronic pain becomes amplified and centralized, transforming what begins as peripheral joint inflammation into the widespread pain sensitization that characterizes advanced arthritis. Magnesium glycinate, the form with the best absorption and the gentlest effect on the gastrointestinal tract, taken at a dose of 200 to 400 milligrams, 30 to 60 minutes before bed, provides both the analgesic NMDA-gating effect on pain processing and the sleep-improving effect that allows the overnight rest that arthritis pain so often disrupts. The sixth compound is collagen, specifically hydrolyzed collagen peptides, which are the form most extensively studied in clinical trials for joint health. A study published in the journal Current Medical Research and Opinion followed patients with joint pain over 24 weeks of hydrolyzed collagen supplementation and found significant reductions in pain scores, improvements in joint function, and reductions in the use of analgesic medications compared to the placebo group. The before-bed approach is particularly relevant for collagen. 10 to 15 grams of hydrolyzed collagen peptides dissolved in warm liquid water, herbal tea, or the golden milk preparation already described, consumed before sleep, when growth hormone production is at its peak. Growth hormone is a primary stimulator of cartilage repair and collagen synthesis, and consuming collagen precursors immediately before the period of peak growth hormone output maximizes the availability of building materials for overnight joint tissue repair. The seventh compound is boswellia, the resinous extract of the Boswellia serrata tree, whose boswellic acids inhibit 5-lipoxygenase, the enzyme responsible for producing leukotrienes, a class of inflammatory mediators involved in arthritis that cyclooxygenase inhibitors do not address. This makes boswellia specifically valuable as a complementary agent to the COX inhibiting compounds we have discussed, because it targets the leukotriene arm of the inflammatory cascade that these other compounds leave unaddressed. A randomized controlled trial published in the journal Phytomedicine found that standardized boswellia extract significantly reduced pain, improved physical function, and reduced the need for rescue analgesic medications in patients with knee osteoarthritis over a 90-day period, with effects that accumulated over the course of the study consistent with anti-inflammatory mechanisms that require sustained daily use to produce their maximum benefit. The relationship between the gut microbiome and joint inflammation is a dimension that deserves specific mention as part of the before-bed protocol. The gut microbiome produces short-chain fatty acids, butyrate, propionate, and acetate from the fermentation of dietary fiber that directly regulate the activity of the immune cells responsible for joint inflammation. A gut microbiome with abundant butyrate-producing bacteria creates a regulatory immune environment that moderates the inflammatory response in joints. Research in rheumatoid arthritis has demonstrated that patients with active disease show characteristic gut microbiome disruptions compared to healthy controls, and that the severity of joint inflammation correlates with specific microbiome composition features. For the before-bed arthritis protocol, adding fermented foods 1 to 2 tablespoons of sauerkraut or kimchi, a small serving of plain live culture yogurt, or a glass of kefir to the evening meal provides microbiome support that amplifies the anti-inflammatory effects of every other compound we have discussed. The gut is the system through which all of the dietary interventions we have described must pass, and a well-nourished, diverse gut microbiome is the biological environment in which they produce their maximum effect. Now let us build the 10-day protocol, because knowing the 7 compounds is only useful if you know how to use them in a consistent, practical, daily routine. Evening with dinner, 2 to 4 grams of fish oil supplement with your meal. 1 serving of fatty fish, 2 to 3 evenings per week. A small serving of fermented foods. Before bed, the golden anti-inflammatory drink: 1 teaspoon of turmeric, a pinch of black pepper, a 1/4 teaspoon of ginger powder or a slice of fresh ginger, a teaspoon of coconut oil, dissolved in warm milk or a warm non-caffeinated beverage, 8 ounces of unsweetened tart cherry juice, 10 to 15 grams of hydrolyzed collagen peptides dissolved in warm water or added to the drink, 200 to 400 milligrams of magnesium glycinate, Boswellia extract, typically 300 to 400 milligrams of standardized extract taken with the evening routine. The 10-day framework works best when embedded in a few broader lifestyle practices that reinforce the anti-inflammatory biology. Evening hydration is specifically relevant to joint health. Cartilage has no direct blood supply and receives its nutrients through the diffusion of fluid from synovial joint fluid, a process most efficient when the body is well hydrated. Drinking 2-3 glasses of water in the hours before bed and avoiding the dehydrating effects of alcohol and caffeine in the evening supports the overnight cartilage rehydration that contributes to reduced morning stiffness. Sleep position can meaningfully influence the overnight joint experience. For hip and knee arthritis, sleeping with a pillow between the knees when lying on one side reduces the rotational strain on the hip and knee joints during sleep. For shoulder arthritis, avoiding sleeping directly on the affected shoulder and using a supportive pillow arrangement that keeps the shoulder in a neutral position reduces the overnight compression that contributes to morning shoulder pain and stiffness. The morning routine matters as much as the before-bed protocol. Before getting out of bed, spend 2-3 minutes in gentle range of motion exercises, ankle circles, gentle knee bends, shoulder rolls that warm up the joint fluid, reduce the viscosity of the synovial fluid that has cooled and thickened overnight, and prepare the joint for weight bearing before it has to take the full load of standing and walking. This transition, consistently practiced, significantly reduces the morning stiffness and pain that arthritis patients find most disabling, and it costs nothing beyond 2 minutes of gentle movement before rising. What most people find when they begin this protocol consistently is that by days 4 to 5, they notice a reduction in the intensity of morning stiffness. By days 7 to 10, they typically notice a reduction in the baseline level of joint pain throughout the day, not its elimination, but a meaningful softening of its intensity that makes movement less difficult and rest more comfortable. This is not a cure for arthritis. What this protocol offers is the most evidence-supported natural approach to reducing the inflammatory component of arthritis pain in a way that is safe, affordable, and sustainable as a daily practice alongside whatever medical treatment your doctor has recommended. Before we close, I want to speak directly to something that many people with arthritis experience but rarely talk about: the emotional weight of chronic pain, and how that weight interacts with the physical experience of the condition in ways that are both real and important to acknowledge. Living with arthritis pain changes your relationship with your own body. It changes how you plan your day, always with one eye on what the pain might allow or prevent. It changes how you move through social situations. The decisions about whether to attempt an activity, whether to ask for accommodation, whether to explain to someone what you are experiencing or simply smile and manage quietly. It changes your sleep, which changes your mood, which changes how you cope with pain, which changes your sleep. It is a cycle that chronic pain patients understand intimately, and that people who have not experienced it often underestimate. The compounds in this protocol have something to offer this dimension of the experience as well, though not directly through their anti-inflammatory mechanisms. Magnesium's modulation of GABA receptors in the brain, the same mechanism we discussed in the context of premenstrual symptoms, produces a genuine anxiolytic and calming effect that can reduce the heightened pain sensitivity that sleep deprivation and chronic stress produce in the nervous system. Tart cherry's melatonin content improves sleep quality in ways that reduce the pain amplification that sleep disruption causes. The ritual of preparing and consuming the before-bed protocol, the intentional act of doing something specific and evidence-based for your own health every night, provides a form of agency over a condition that can feel overwhelming in its relentlessness. Agency matters in chronic pain management. Research in pain psychology consistently documents that the sense of having effective tools for managing one's own pain is one of the most powerful predictors of quality of life in chronic pain conditions, more powerful in many studies than the absolute level of pain experienced. The person who believes they have nothing to offer their own condition fares significantly worse than the person who believes they have tools that work and uses them consistently, even when those tools produce only partial relief. This protocol is a set of tools that work. They are not miracle cures. They are the best evidence-supported natural interventions available for the specific biological mechanisms that produce arthritis pain, used consistently, combined thoughtfully, and understood clearly enough to use with genuine confidence. The quercetin in tart cherries and the resolvins produced from omega-3 fatty acids are not just fighting inflammation in your joints tonight. They are contributing to the biological environment in which cartilage cells can repair more effectively, in which the immune cells of the synovium can shift toward resolution rather than perpetuation of inflammation, and in which the pain signals your nervous system processes are modulated toward a lower baseline intensity. These are measurable, documented biological effects. They require time, which is why the 10-day protocol is framed as a minimum rather than a maximum. The people who experience the most meaningful relief from this approach are the ones who incorporate it not as a 10-day experiment but as a permanent evening routine, as fundamental to their arthritis management as any prescribed medication, and as non-negotiable a part of their night as brushing their teeth. The research supports this approach. The biology supports this approach. And your experience, if you commit to it fully and consistently, will support it too. Start with what is most accessible to you. Golden milk tonight, turmeric, pepper, warm milk, 30 minutes before bed is as simple as it gets and as powerfully anti-inflammatory as anything in this video. Add the tart cherry juice tomorrow. Add the magnesium glycinate the day after. Build the protocol one compound at a time until the full routine is established, and then keep it. Your joints deserve that consistency. And so do you. The science of resolvins and protectins, the specialized pro-resolving mediators that EPA and DHA produce, represents one of the most important recent advances in our understanding of inflammation and why it sometimes becomes chronic. For decades, inflammation was understood primarily as something to suppress, a process to block, inhibit, and reduce. The discovery of the resolvin and protectin pathways revealed that normal inflammation has a built-in resolution program, a set of active signaling molecules whose job is not to block inflammation, but to turn it off when the defensive response is complete. In chronic arthritis, this resolution program is impaired. The joint continues producing inflammatory signals because the pro-resolving mediators that would normally terminate the inflammatory response are insufficiently present, often because the EPA and DHA from which they are made are insufficiently available in the joint environment. This is why omega-3 supplementation in arthritis does not simply reduce inflammation, it restores the resolution capacity that the chronic inflammatory state has depleted. It does not only fight the fire, it restores the mechanism that would have put the fire out on its own. This distinction matters for understanding why the results of omega-3 supplementation in arthritis take 2 to 4 weeks to become maximal, because it takes that long for the EPA and DHA to incorporate into cell membrane phospholipids in sufficient concentrations to shift the prostaglandin and resolvin balance in the joint toward resolution. The patience that the research asks for is not arbitrary. It is the time required for the biology to do what it is designed to do when given the right substrates. Similarly, phosphorylic acid's inhibition of 5-lipoxygenase addresses a specific arm of the inflammatory cascade that is particularly relevant to the pain and swelling of acute arthritis flares, the leukotriene pathway that produces the potent inflammatory mediators leukotriene B4 and the cystianoleukotrienes that contribute to synovial swelling, cartilage degradation, and the characteristic morning stiffness of inflammatory joint disease. By targeting this pathway specifically, Boswellia adds a dimension of anti-inflammatory coverage that none of the other compounds in this protocol addresses, making the combination more comprehensive than any single compound alone. The science of resolvins and protectins, the specialized pro-resolving mediators that EPA and DHA produce, represents one of the most important recent advances in our understanding of why arthritis inflammation sometimes becomes chronic. Normal inflammation has a built-in resolution program, a set of active signaling molecules whose job is not to block inflammation, but to turn it off when the defensive response is complete. In chronic arthritis, this resolution program is impaired. The joint continues producing inflammatory signals because the pro-resolving mediators are insufficiently present, often because the EPA and DHA from which they are made are insufficiently available. This is why omega-3 supplementation in arthritis does not simply reduce inflammation, it restores the resolution capacity that the chronic inflammatory state has depleted. It does not only fight the fire, it restores the mechanism that would have put the fire out on its own. The concept of combining natural anti-inflammatory compounds that target different points in the inflammatory cascade rather than relying on a single agent is sometimes called nutraceutical combination therapy, and it represents the most sophisticated approach to natural arthritis management that the current research supports. The 7 compounds in this protocol were chosen because together they address every major anti-inflammatory mechanism validated for joint disease: NFKB inhibition from curcumin, prostaglandin substrate competition from omega-3 fatty acids, direct COX inhibition from tart cherry anthocyanins, dual COX and LOX inhibition from ginger, NMDA receptor gating from magnesium, cartilage matrix rebuilding from collagen peptides, and leukotriene pathway inhibition from Boswellia. Each compound fills a gap that the others leave open. Together, they form the most complete natural anti-inflammatory protocol that the evidence currently supports. Living with arthritis pain changes your relationship with your own body. It changes how you plan your day, always with one eye on what the pain might allow. It changes your sleep, which changes your mood, which changes how you cope with pain, which changes your sleep again. The compounds in this protocol have something to offer this dimension of the experience as well. Magnesium's modulation of GABA receptors produces a genuine calming effect that can reduce the heightened pain sensitivity that sleep deprivation and chronic stress create. Tart cherry's melatonin content improves sleep quality in ways that reduce the pain amplification that sleep disruption causes. And the ritual of preparing and consuming the before-bed protocol, the intentional act of doing something specific and evidence-based for your own health, every night provides a form of agency over a condition that can feel overwhelming in its relentlessness. Agency matters in chronic pain management. Research in pain psychology consistently documents that the sense of having effective tools for managing one's own pain is one of the most powerful predictors of quality of life in chronic pain conditions. This protocol is a set of tools that work. They are the best evidence-supported natural interventions available for the specific biological mechanisms that produce arthritis pain, used consistently, combined thoughtfully, and understood clearly enough to use with genuine confidence. 10 days. 1 before bed routine. 7 evidence-based compounds. The biology is on your side. If this video gave you something specific and actionable for your arthritis pain, please support this channel. Hit the like button right now. Subscribe so you never miss a video like this. And leave a comment below. Tell us which of the 7 compounds you are going to add first, and whether you have tried any of them before. We read every comment. Your experience with this protocol matters to us and to everyone in this community managing the same challenge. Start tonight. The first cup of golden milk, the first tart cherry juice, the first capsule of magnesium glycinate. Start tonight. Your joints will thank you in the morning. Thank you so much for watching. See you in the next one.